Good morning, everyone. Today, we're joined by Dr. Alexandra Phelan, Assistant Professor of Microbiology and Immunology, and a member of our Center for Global Health Science and Security at our medical center. She completed her doctorate at our law center, where she also teaches. And Dr. Phelan, it's wonderful to be with you for this conversation, and I'm so grateful to you for taking this time. Your work is at the intersection of infectious disease outbreaks, governance, and international law. Can you talk about how you see international law used in responding to infectious diseases? What role can international law play, and what are we seeing at this moment as we wrestle with this pandemic?
Yeah, so thank you very much for having me, Jack. It's wonderful to be here. I think international law has a number of roles in responding to and preparing for infectious diseases. Firstly, it sets the minimum standards of what countries and international organizations should do preparing for and responding to a crisis. It is a way of fostering collaboration and coordination and solidarity between countries on how they should go about solving challenges, particularly those that are of a sort of transnational threat. And I think fundamentally it is also a tool for accountability, whether we're talking about through human rights or we're talking about the laws that the WHO has about notifying outbreaks. The idea is international law can then hold states accountable for these promises they've made in the international arena. Now, during COVID-19, we've seen various levels of compliance with that. And I think one of the big questions going forward is going to be, how do we change that to improve that collaboration, particularly in regards to vaccines, and do we hold countries accountable for certain decisions and processes and failures throughout this pandemic?
Yeah, no, thank you. Now, since it was established in 2016, our Center for Global Health Science and Security has worked on issues related to preventing, predicting, and responding to global health threats. One of these projects was a report this past July, which you published with our center director, Dr. Rebecca Katz. It was entitled Governance Preparedness, Initial Lessons from COVID-19, and commissioned by the Global Preparedness Monitoring Board. At the time of its publication, what was your assessment? And where do we find ourselves now, 6 months later?
Yeah, so I think the main finding that we had from that report was that for all of our focus on technical capacity, on the ability to have labs and surveillance systems and contact tracing, hospital beds, a healthcare workforce, all of these things that are critical for responding to infectious diseases and pandemics, and all of our metrics were focused on that. The reality is if you don't have good governance, if you don't have leadership that can then use and coordinate those resources, then there's no point having them and the system falls down, right? And what we've seen around the world, here in the United States, unfortunately, have been examples of where that leadership hadn't occurred and where the tools and the skills that were available weren't used. And we also saw some gaps in that governance at the international level. We really haven't had a coordinated response through UN agencies, despite the scale of the pandemic affecting so many aspects of our lives around the world. And so what we saw really was these governance failures that meant that we were very slow in responding to alerts. So the WHO declared a public health emergency of international concern on the 30th of January 2020. Many countries didn't make any response until well into March. And so, there are a range of questions around whether countries took seriously their obligations under international law, if we have to revise those laws. And right now, that's the focus of a lot of different independent expert groups looking at those potential reforms. But I think going forward, one of the major questions is going to be is how do we redress those governance gaps at the national level? And the first steps really are about ensuring people having access to voting and representative democracy and evidence and science-based leadership in our politics.
Now, talk a little bit more about your work and the center's work, particularly over this past year. Tell us a little bit about the directions that your work is taking and the center's work have been taking as we've been wrestling with this pandemic.
Well, I want to start with mentioning the work of the students that we are so fortunate to have working with us as research assistants. We have undergraduates, we have master's students, we have students from the Law Centre, all who've been working tirelessly on a range of different COVID-19 projects. A major one is the Centre's COVID Analysis and Mapping of Policies, which is a tool that has gone through and tried to map in the United States, but then also around the world, the policies and laws that countries have adopted in response to COVID-19 in trying to mitigate the spread of COVID-19. That's a really powerful database and huge amount of student work going into that we're all very proud of. In terms of, for myself, obviously this is built in with a lot of research projects that I already had going on about international law and infectious disease. One of them is looking at international law for the equitable distribution of COVID-19 vaccines. And over this period, I've written a few pieces for example, in The Lancet about the use of or challenges of using immunity passports or even vaccination certificates. And also the way in which legal agreements, so advanced purchase agreements, contracts have been used by governments to essentially guarantee their own national vaccine supply to the exclusion of other countries, which is a significant distributive justice challenge and issue. I've been honoured to serve on a number of National Academies of Sciences, Engineering and Medicine committees, including the Standing Committee on Emerging Infectious Diseases, and the Committee on Data Needs to Monitor the Evolution of SARS-CoV-2. And as we've seen with the emergence of new variants around the world, the importance of having those national systems to monitor potential mutations and changes is so critical. We continue our work with international organisations like WHO, and it all ties into the work we were doing before and will continue to do. But COVID-19 has obviously been a significant lift and impact on the speed at which we do that work and the amount of work that we do in this space.
Now, last week, the United States reaffirmed its status as a member of the World Health Organization and committed to joining COVAX, a global partnership to ensure that COVID-19 vaccines are distributed across the world. Can you share a little bit about the importance of vaccine equity and the role of the international community?
Yeah, so let's start from the purely practical public health angle. And the practicality is the world will not be in a post-pandemic world until the entire world has access to COVID-19 vaccines. Because of the way in which we rely on that vaccination to give us protection within communities, including for people that are unable to get the vaccine, and to interrupt the chains of transmission. And it is increasingly important, as the emergence of variants have perhaps indicated, that we get that rollout as rapidly as possible. So we interrupt transmission and interrupt the opportunities for this virus to potentially outpace what our vaccine can actually do, what our vaccines can actually do. There's also a really critical justice angle here. It would be a moral catastrophe, to use the words of Director General Tedros, if vaccines were only available in high-income countries. And the reality is the way these laws and contracts have been used to guarantee access to vaccine supply in certain countries is meaning that we're on the path already, that some countries, particularly high-income countries, have access to vaccines that will not be made available in the rest of the world, particularly in low-income and middle-income countries. And we have significant risk of not just a public health failure, but this moral and ethical failure. There are a number of countries that have very low burdens of COVID-19, high-income countries that have very low burdens of COVID-19 and yet have guaranteed themselves supply of the vaccine. And these are really significant questions we need to be talking about on the international stage. When we think about how these rollouts are happening, we have distributive justice issues both between countries, as we've discussed, but also within countries. Who is getting access to the vaccine, and ensuring that the most vulnerable, most likely to be severely affected or contract SARS-CoV-2 and COVID-19 get access to those vaccines.
Thank you. Thank you. Now, you recently taught a seminar session on epidemiology for lawyers. Can you tell us about this seminar and the key areas that it focused on?
Yeah, so I've been teaching Epi for lawyers for about 6 years, I think now, and I continue to teach it despite it doesn't count into any of my my own tenure or anything like that. I teach it because I think it is so fundamentally important that our future policymakers, our advisors to policymakers, people who go into the legal profession as lawyers, assessing evidence, or as judges, have an understanding of scientific literacy and a grounding in scientific literacy. In fact, I think, if it were not for the awareness of what an epidemiologist is now as a result of COVID-19, I would have pushed to change the title to scientific literacy for lawyers. Essentially what we cover is how do you read a scientific paper? How do you spot the potential issues with the way evidence is presented and identify gaps in evidence? And how do you weigh different types of evidence, depending on what the study is and how it's been conducted? How do you interpret risk? And then how do you apply it to policymaking? And really, is science and evidence-based policymaking the be-all and end-all, or is there an important role, and that's the giveaway, for democratic policymaking? And how do you balance the needs of a democratic legal system, democratic lawmaking, with also having strong science and evidence-based policymaking? I think the students each year seem to really enjoy it, and it involves a little bit of maths, a little bit of statistics, but really it's about the way of thinking and critical thinking. And lawyers are familiar with ideas of causation and probability, and it's just showing them how you apply that same critical lens to perhaps scientific evidence presented.
Thank you. Thank you. I can't thank you enough for taking this time to share your perspectives with us. In closing, is there a message that you'd like to share with our community?
Yeah. I think we've heard the word solidarity a lot over the last year, and it is really key. We're not out of the woods yet. Even once vaccines are distributed, we're still learning more about what those vaccines give us in terms of immunity, in terms of transmission. But there is light at the end of the tunnel, and it is an incredible effort that has gotten us to the point where we have vaccines a year, nearly 5 days out from the 1-year anniversary of this declaration of a public health emergency of international concern. I think the big question for those of us in the broader Georgetown community is how our work can continue after this pandemic to address not only the inequities caused by COVID-19, or caused by the systems that COVID-19 was able to exploit, but also how do we create a more fair, more just, more equitable society that prevents pandemics from happening in the future.
Yeah, thank you. Thank you. And again, we're so grateful to you for all of your important contributions and your leadership during this critical moment for our global community. And thank you for being with us. And I look forward to being with all of you again soon. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.